have a patient. She's a colon cancer patient and she's undergoing chemotherapy and immunotherapy at the same time. After the second cycle of chemotherapy, she became very weak. And she told me that maybe she cannot continue the chemotherapy. So that's when I introduced her PPAR, no? I used just the PPAR soft gel capsule, no? And it made wonders to her, no? She already completed the 7th cycle of her chemotherapy, yes. And the surveillance showed that the tumor decrease in size, no?
Welcome everybody to another episode of Simply Healed by Simply Nature. Today we have our very special guest, our oncological surgeon, Dr. Jimmy Catapia. So welcome from
Manila Medical.
Welcome again to our program, Dr. Jimmy.
Thank you, Sean, and thank you everyone for joining us today for this very exciting topic, no? Colorectal cancer.
Colorectal cancer, yes. We are very fortunate, as on our programs, we invite doctors, and it's so rare and so difficult to hear an oncologist online speaking and answering cancer questions. So don't miss your opportunity today. If you have any questions about cancer, you have Dr. Jimmy right here with us on this program. It's the perfect opportunity to ask him, all right? And today we're going to talk about colorectal cancer. Colorectal cancer is one of the top 5 cancers in Philippines.
It's actually the number 5 cancer in the Philippines.
Number 5 cancer in the Philippines. One of the first questions I wanted to ask, Doc, is that, of course, when every time a patient realizes that they might have cancer, the big question is, are they going to die? So in terms of how dangerous or how worried should a person be if they think they have colorectal cancer, or if they are going to be diagnosed with colorectal cancer, is it something that they should be so worried, like for example lung cancer or leukemia?
Actually, colorectal cancer by itself is really dangerous, no? In fact, in 2015, the number of new cases equals the number of mortalities.
Wow.
Colorectal cancer, no?
Oh, I always thought colorectal cancer was a slow cancer and not so dangerous.
Actually, it's a slow cancer, slow growing cancer. But if you catch it in a more advanced stage, in for example stage 4 already, it becomes very deadly.
Oh, it becomes very deadly.
Yes.
So if you are stage 4 colorectal cancer, what is the normal prognosis? How long would you give a patient?
Actually, the prognosis is still good because of the developments in treatment nowadays.
Okay.
Aside from surgery, we have many good drugs like immunotherapy, chemotherapy, and radiotherapy that can prolong the life of those patients.
What's the success rate, Doc, if you are diagnosed with, let's say, stage 1, stage 2 colorectal cancer? What's the success rate of beating the cancer?
Oh, very high.
How high would you give?
Especially if it's only stage 1. No, the 5-year survival rate is almost 100%.
Huh?
Yes.
100%? Wow! So if you can catch your colorectal cancer in the early stages, the 5-year survival rate is 100%.
Yes, almost 100%.
Almost 100%. So,
good day to all of you. So if you have any questions regarding our discussion for tonight, just feel free to comment on the comment section below so we can address you.
First question today we want to ask is, what are the warning signs that you have colorectal cancer?
First of all, changes in the bowel habit. No, you must check your stool always. Look at your stool. Yes.
Yeah, I just want to share this really funny fact. Those of you who have watched The Last Emperor, Doc, do you remember that movie? It's about the last Chinese emperor. I remember there was a scene that was so strange to me, right? The emperor will poo-poo every day into his potty.
Yes.
And then they will have the royal physician. I wouldn't want to be a Chinese doctor back then. There will be 3 of them. One of them will sniff the potty, smell the poo-poo, and another will actually pinch and eat the poo-poo. And then they will taste it, and then they will make adjustment to the emperor's diet based on the poo-poo. So yes, it's important to look at your poo-poo.
Actually,
So
you can diagnose many diseases with the poop.
really, so it's true, right? So okay, doc, when we examine our poo-poo, what is the things that we should look out for?
If there is fresh blood, that's dangerous, no? That's a warning sign. And also, if your poop, the color is tar black.
Tar black,
Yes.
all right? Not dark chocolate, but if it's really black, you should be worried, all right? Okay. Anything else? What about the firmness, sinking poo-poo, or what if does the easiness of doing your bowel also a symptom of potential colorectal cancer?
Sometimes if you have alternating symptoms of constipation, then diarrhea, sometimes it can also be a risk sign, a warning sign, no?
Okay.
For colorectal cancer.
How often are we talking about? One day diarrhea, one day constipation, or within the same day you have constipation and diarrhea? Or is it a few days constipation, a few days diarrhea? When is this combination, what's the frequency where you really should be worried?
It depends on the level of obstruction and the degree of obstruction, no?
Okay.
Okay, in the level, I'm saying if it's in the colon or if it's in the rectum, and when I say the degree, if it's totally obstructed or it's just 50% obstructed, so those symptoms of constipation and diarrhea might alternate.
Wow, okay, so symptom number one, you gotta look at your poo-poo, all right? If it's tar black in color, that's a warning sign. Blood in the stool, warning sign. Having diarrhea and constipation, alternating between that's a warning sign as well. Any other warning signs that is not stool related? What about pain?
Yes.
Okay.
Sometimes there will be pain, especially if the tumor, no, the colon cancer has invaded the entire colon, the entire intestine, large intestine, or it invaded other organs. There will be pain.
So there will be a dull pain in your abdomen?
Yes.
Oh, okay. So that's another thing to look out for. Doc, if we have any of these symptoms, what should we do?
Of course, first consult a doctor.
Okay, if you need a doctor to consult, right, make an appointment with Dr. Jimmy. Simply drop us a message now on the Facebook Messenger, and we can arrange for a consultation.
Good day, everyone. If you want to have an online consultation with me, just comment down below, and our team will contact you after.
Doc, what would you do with a patient when a patient comes to you? So that just to let everybody here know what is the patient journey. You know, when the moment a patient comes to you and he thinks that he has some colon issues and you suspect colorectal cancer, what are the first things that you will do with him? Are you going to send him for a coloscopy, or what would be the process?
So when a patient visits a doctor,
Yeah.
the first thing is to confirm if there really is blood or suspicious blood in the feces. So most of the time, doctors will do the rectal exam, the digital rectal exam.
Which means you put your finger
Yes.
up there. Okay. All right.
And also palpate the abdomen of the patient to see
Okay.
if there's any palpable tumor. No?
Oh, okay.
If there's none, most of the time doctors will ask for a fecal exam. It's called the fecal occult blood test.
Okay.
To see if there are red blood cells in your feces. No? If there is, the doctor might advise you to have colonoscopy.
Okay.
And-
Doc, just to check, how much is a digital rectum examination? How much would a normal doctor charge for that? And how much for a fecal diagnostic test as well?
Actually, it's just a simple physical examination,
So-
the digital rectal exam. You just use your hand.
Okay, so no
very-
extra charge.
It's uncomfortable for the patient, but I think no extra charge.
No extra
from the
charge.
doctor's
That's
side.
good news.
Yes.
Then what about the fecal test?
Occult blood test.
Yeah.
Actually, it's not expensive. No, it's a simple.
Few hundred
laboratory
pesos?
test. Maybe 200 to 300 pesos.
200 to 300 pesos. You know, I ask this because many viewers out there, you know, don't be afraid to go and get yourself tested. So as you can see, the first two tests that you will undergo if you suspect yourself of having colorectal cancer or issues of that sort, it's not even going to run you 1,000 pesos, right? You consult with your doctor, he'll give you a free digital rectal exam, and then a fecal diagnostic only costs about 200 to 300 pesos. So with that, you can already move towards, and if both come out negative, that means they are quite safe from colorectal cancer, or should they still go
not
for?
Not really.
Okay.
The doctor still suspects that there could be tumor in the colorectal region of your body. The doctor might request for a CT scan of the
CT
abdomen.
scan. As we all know, CT scans are not too expensive also.
Around 18 to 25,000.
Oh wow, 18 to 25,000. So doc, if the what would make you send a patient for a CT scan if the digital examination and the fecal comes out negative? What will you look out for that will say, I think you still need to go for a CT scan?
For example, there's still an unexplained weight loss. For example, the symptom of the patient is associated with an unexplained weight loss, and if there's really a pain in the abdomen, no? Some doctors will settle for an ultrasound first because it's more
Cheaper.
available and cheaper, but some will outright request for a CT scan of the abdomen.
All right, so I hope that's clear for everybody. So go and get yourself tested, because as Dr. Jimmy said, if you catch colon cancer in stage 1 and stage 2, it's almost, it is 100% survival rate for the 5-year mark. How easy is it to catch colon cancer in the first and second stage?
Actually, it's not. Here in the Philippines, usually we catch patients in the more advanced stage.
Is it because they don't do the colon examination that they should at 45, right? When you're 45 years old, you should do the testing.
The testing, actually, the fecal occult blood test, it's the screening for colon cancer. But not all Filipinos do that.
Okay, so the difficulty is not the actual, it's not that it's hard to detect colon cancer, it's because we don't do the test.
And also, as Filipinos, if we feel something painful or feel something uncomfortable in our tummy, in our abdomen, sometimes we just say, oh, it's nothing.
Yeah,
We
because
don't
Filipinos like to eat a lot of food, so maybe having a tummy ache is nothing.
Good day to all of you. So if you have any questions regarding our discussion for tonight, just feel free to comment on the comment section below so we can address you.
Alright guys, so wonderful. Doc Jimmy shared that the main reason why a lot of colon cancer patients are diagnosed in their late stages is because we do not go for testing the moment we feel uncomfortable. So as Doc Jimmy has assured everybody, a simple digital rectum exam and a fecal test is just a few hundred pesos, right? So unless you have prolonged pain and other symptoms, these two examinations should be able to put your mind at ease. So go and visit your doctor every time, whenever you feel such symptoms. Again, your stool is tar black in color, you have bleeding, and you have constipation and diarrhea alternating. So go and see your doctor. The cost is manageable. At least you have a peace of mind. And if it is something serious, you'll be able to catch it early. And the survival rate is 100% if you catch it early. Now, Doc, if you catch colon cancer early, what is the standard treatment for colon cancer, colorectal cancer, if it's stage 1 or 2?
That's a good question, no? So surgery remains the central treatment or management for colon cancer, no? So if you have colon cancer, you need to undergo surgery. Then after that, it depends on your stage, final histopathologic stage. If you will have to undergo adjunct treatment or therapy after that. Adjunct therapy like chemotherapy, radiotherapy, or immunotherapy, they can be given actually to advanced or higher stage colorectal cancer.
But if it's stage 1 and 2, will you actually prescribe chemotherapy to stage 1, 2 patients?
In general, if it's just stage 1, you do not do chemotherapy and radiotherapy. But for stage 2, it depends on the situation and also the histology of the tumor.
So again, to all our listeners out there, if you tune in today, because I'm sure if you tune in today is because you yourself or some loved ones you suspect may have colorectal cancer. And the good news, as Dr. Jimmy has shared, is that if it's caught early, stage 1, normally we do not even prescribe chemotherapy, and only for stage 2 under certain conditions. But if you delay and do not go for testing, then your colon cancer might develop into late stage, and that for sure, chemotherapy, surgery, right? So, Doc Jimmy, even for stage 1, would it be advisable to do surgery? What if someone wants to avoid surgery? Can they avoid surgery if it's stage 1?
No, it's not, you cannot avoid surgery with colon cancer.
Okay. Why is that the case?
Because the tumor is in the colon, you have to remove the tumor. Chemotherapy alone, or even radiotherapy and chemotherapy alone, is not an adequate cure for colon cancer.
Doc, you specialize in oncological surgery, right? So I think surgery is something that Asians are afraid of.
Yes.
What's the success rate of colon cancer surgery? Is there a lot of risk? Is it a difficult operation?
Actually, it's not. If you're if you're in good hands, no. If you go to the specialist, it's not really a very difficult operation, no. Nowadays, that we have the minimally invasive techniques. Before, we always open up the abdomen, cut and cut, no?
Oh.
But now we have the laparoscopic techniques, we have the robotic techniques, no? So you can have colorectal cancer surgery with very minimal incision in your abdomen.
Oh, so you don't even need to make a big cut?
Yes.
Oh, wow. So how long is the surgery, and how long would it take to recover from the surgery?
The surgery itself range from 2 to 4 hours, no? The duration of the surgery. Recovery depends, of course, on your it depends per individual, no? There are those without comorbid conditions that will recover very fast. In about a month's time, they can return to work. But there are those with other comorbid conditions. It will take them around 2 to 3 months to recover.
So comorbidities are so important, right? So you are talking about diabetes, hypertension,
heart problems.
Yeah. So again, guys, take your PPAR tablets because your PPAR tablets manage comorbidities. So that's the best bet, even if you are preparing to go for surgery.
Good day, everyone. If you want to have an online consultation with me, just comment down below and our team will contact you after.
Wow, Doc, we've heard the very basics of colon cancer, and I think so that we want to move to Q&A where there people can ask more interactive questions, something more specific to their needs. So before we end this segment of discussion, Doc, I want to ask you, have you used PPARs with patients that are undergoing chemotherapy and fighting cancer? And what's your advice for patients who are planning to use oncological protocols like surgery and chemotherapy, immunotherapy? How can they prepare themselves for chemotherapy and go through chemotherapy and immunotherapy and other oncological protocols successfully and less painfully? I guess that's the important question.
Yes, I do actually. I at present I have a patient. She's a colon cancer patient and she's undergoing chemotherapy and immunotherapy at the same time. After the second cycle of chemotherapy, actually she became very weak, and she told me that maybe she cannot continue the chemotherapy. So that's when I introduced her PPAR, no? I used just the PPAR soft gel capsule, no? And it made wonders to her, no?
Oh, so now how many sessions have she gone through now?
She already completed the 7th cycle of her
7 cycles?
chemotherapy, yes.
But actually after the first session, she already wanted to quit.
Yes.
So because of the soft gel, she was able to continue. And what's the result of her treatment?
During our last surveillance, I advised her to do surveillance CT scan, and the surveillance showed that the tumor decreased in size, no? Her liver tumor, because she has metastasis to the liver.
Wow, metastasis already. So that's already a late stage cancer.
Yes, it's actually a late stage cancer. I already removed the colon tumor, but there's still the liver tumor that we have to address.
Is liver, when a cancer metastasizes to the liver, it's actually difficult to...
Stage 4.
It's stage 4 already. But yet her tumor size has decreased.
No? So now that it has decreased, there's the possibility to remove that liver cancer.
Wow, that's good news. So we are ready to go to Q&A, but as Dr. Jimmy said, Use PPARs to bolster your chemotherapy and your oncological therapies so that you will do well. And he just shared a wonderful case study of a patient who, even after a single session of chemotherapy, started to feel the side effects. But we have said it so many times on our program that with SimplyNature PPARs, you can actually go through chemotherapy successfully and with less or even little side effects. The last time, Doc, you're familiar with Doc Johnson, right? Yeah, Doc Johnson was sharing that one of his patients was breast cancer metastasized to the bone. So that's already very serious. And then she did 2 cycles of chemotherapy and she wanted to call it quits. Cannot continue anymore. She said no. And what happened was that Doc Johnson told her to go on to he uses the liquid. The liquid. So what happened was that she went on to finish all her chemotherapy sessions. And right now, breast cancer metastasized the bone. And after more than 5 cycles of chemotherapy, 0 hair loss.
Wow.
0 hair loss. Shopping in the mall during COVID, GCQ, eGCQ.
Yes, and at the end of the day, what's most important for the patient is the quality of life.
Yes, and bone is very painful,
Especially for patients like her, no?
Yeah.
Stage 4 breast cancer, no?
but she was shopping.
Chemotherapy will extend her lifespan,
Yeah.
but if the quality of life is poor, I think it's not a success.
So it's really great news. So again, this is another example of how you can combine chemotherapy and Simply Nature. So if you want to find out more, if you want to consult with Dr. Jimmy, please just leave a message. And right now we'll move to Q&A. So we're going to answer all your questions. Doc, are we ready for Q&A?
Okay.
Let's go!